Hi, I'm Dr. Fariba Dehim, board certified bariatric surgeon, board certified obesity specialist, and also certified nutrition specialist. Today's question is one of the most common questions that doctors and dietitians get. How much protein do I need? It's an excellent question, which at the same time is a moving target, because the answer is completely different depending on your gender, on your age, if you're still growing, if you are an elderly person, on the amount of the activity you do, if you're a woman, if you're pregnant or not, if you're trying to lose weight or if you're trying to gain weight, if you have gone through a recent trauma, if you're preparing for surgery, if you're recovering from surgery, if you have an open wound that's healing, and a lot of other factors. The first thing that we should know is that proteins are part of our macronutrients. Macronutrients are the food that we need in larger amounts. The three important macronutrients are carbohydrates, proteins, and fat. It means that they all play an important role in our health. But the type of them is important. So all this fear of carb can be wrong as long as we are doing the right carb and in the right amount. But back to proteins. Name protein comes from the Greek word proto, which means primary. So it's the lead nutrition. Why proteins are so important? Because all the important structures in our body are either made of protein or have a combination of protein with another chemical. So for instance, our muscles in particular, our cartilages, a lot of hormones, all the enzymes, significant parts of our structure of our cells in general, they're made of protein or protein-related structures. So for an average adult who is not pregnant, is not breastfeeding, is not growing anymore, is not particularly in the elderly age, and we are going to talk about that later, and is not trying to be a bodybuilder, is not trying to gain or lose weight, is not recovering from any serious disease, infection, trauma, does not have an open wound, and basically does not need extra needs. The average amount of protein needed daily is 1 gram to 1.2 grams per kilogram of their weight. A lot of people may think as we age, we need less protein, and that is actually far from the truth. It has been shown that sarcopenia or loss of muscle mass in the elderly can be avoided or at least decreased by improving exercise as well as high quality proteins.